Hello, I'm Dan Jones. I'm the supervisor for interventional radiology, and this is...
I'm Dr. Lamba. I'm an associate professor in radiology.
Hi, I'm Rajiv Rao. I'm one of the current chief residents for radiology, and this is my co-chief Felix Wong. We'll be behind the camera here, and we'll be editing the video for you guys.
So today what we're going to do is we're going to show you how to set up a tray. And the purpose of this module is to train the CT and ultrasound technologists and also the IR technologists. Dan, is that correct?
Correct.
How to set up a tray prior to a procedure. So, to set up a tray, there's a requirement that you must have a hat and a mask on. You need to be in scrubs. A sterile gown is not required for setting up a tray by an interventional technologist.
Correct.
So the first step over here, you really don't need to wear your gloves at this point. Dan, can you please show us the tray and open it?
So this is the basic biopsy tray that we're going to be using for these procedures. So the first thing you want to do is open the biopsy tray. You don't have to worry about contaminating the exterior of this tray because it's not sterile at this point. Now, this can be discarded. You don't have to worry about wearing any sterile gloves at this point, but there is a specific order in which you're going to open the flaps. So the first step is you're going to open the top flap and you're going to fold it away from you. And then you'll notice the most superior flap, which is on the right side, open it to the right, and you'll open the next flap to the left. And this is a very important part. The last flap you're going to open towards you, and you're going to make sure that none of your skin or any of your arms are going over the sterile part of the tray. So you open that towards you. So it'll look like that. So everything from here on out is going to be sterile, so it's going to require you to wear sterile gloves, okay? But prior to putting your sterile gloves on, you're going to want to drop all of your supplies onto the sterile field.
Thank you, Dan.
So prepare your sterile gloves off to the side somewhere. And your partner, if you have one, is going to drop the supplies for you. You have 4x4s here. There's a 12cc syringe. Then you have your fenestrated fistulogram drape. You can touch the outside of this because it's not sterile. Now we'll be handing this to Dr. Lamba, which is in sterile gloves.
So I'll talk to you about all the different components in the tray, and what you want to do is you want to have an order in which you do this. When you present the tray for a radiologist or prep a tray for a radiologist, you want it to look very organized. It should not look disorganized. This is the sterile drape that comes in the tray. This will be set aside over here for the radiologist to don when he gets into the room. This would Dan just provided for me. Dan, can you talk about this sterile patient drape, please?
Sure. So this is a fistulogram drape. It has a fairly large fenestration. That's the area in which the physician is going to be working. And after you prep the patient with the core prep stitch, you're going to place this over the area of interest.
So I do want to talk about one thing. Dan just dropped this into the tray. Now in the future, very soon, this is going to be part of the
Correct.
biopsy tray. Is that correct, Don? And this is going to replace the existing drape that we have over here. Now the problem with this existing drape is that when we do ultrasound procedures, it's actually now very helpful. It has a small window over here, and sometimes this window is not even large enough to accommodate a large transducer head. It is not uncommon in ultrasound, after you've prepped the field and you've placed this drape, that you may want to change your entry site. In that case, this drape must be removed and moved to a different spot. It's actually better to have a wider window drape, as we've discussed, so that we have a better field, a larger field to work with when doing an ultrasound procedure. Now this drape would work fine for a CT procedure, except that I'm going to open this drape. I'm going to show you how big it is. It's really not large enough to provide a good sterile field. Hence we decided that we would discard this drape and we are going to use a larger drape for procedures so we can have a larger sterile field to work with. So for now, I'm going to leave this on the field and I'll move on to the next steps. I'm going to place this underneath this drape and we'll show you this drape in a minute. So right now what I'm doing is I'm just taking things out of my tray and I'm placing them on the field in a systematic way. Now these are sterile towels, and we're not going to discard them because we can always use these sterile towels to increase our sterile field should we need to. So I'm going to place these together with the drapes beneath the drape over here. This is what the tray looks like. First thing, I'm going to get the lidocaine out of the wrap. I'm going to put it over here. I'm going to get rid of this. So things that are not needed should generally be trashed. It's a good idea to have a trash can sitting right next to you. Next thing, I'm going to open the lidocaine vial. Now this does not have a plastic pop-off lid, so you have to open this a little carefully. So here's the little tab at the top. You want to lift this off with your hands, and there's a couple of fenestrations here on the side, and you want to slowly pull it towards the fenestrations over here, and not with a lot of force, but gently bring it down. You want to bring this down and peel it off. And you can discard this. Pop open the lid, throw it away, or maybe keep it in the tray. Make sure there's no particulate matter in the lidocaine. It's always good to inspect it, just like you would when you were drinking a good glass of wine. Make sure it is labeled 1% lidocaine. Also, we use epinephrine-free lidocaine, is that correct?
Correct.
The next thing I'm going to do is, you want to talk about this red piece over here?
So this is the sharps container. It comes in a plastic exterior with a sponge in the middle, which is labeled.
The container that it comes in, we will discard. There's a little sticky tab at the bottom. We're going to take that off. We're going to remove this, and we're going to stick this on the tray. As you can see, this is numbered 1 through 10, and that gives you an order for putting your sharps into this. All right. The next thing we're going to do over here is drop the lidocaine. The tray comes with a 20 cc syringe. We are discussing replacing this 20 cc syringe with a 12 cc syringe, and the reason we're going to do that is when you're going to do a drain, we just want to see a diagnostic sample of fluid, and we don't want to see more than 1 to 2 cc of that fluid. We don't want to suck the entire fluid out when we're getting the diagnostic specimen, because we need to place a drain into the collection. So all we need is 1 to 2 cc, and if we're going to do a biopsy, a fine needle aspiration biopsy, we really prefer to have the 12 cc lower lock syringe rather than a 20 cc syringe, because this tends to be a little bit more unwieldy. So the 20 cc is going to be replaced with the 12 cc syringe. That's going to be in here. But you will have 2 additional 10 cc syringes with lower locks in your tray, and these are going to be used for lidocaine. There is a blunt 18 gauge needle. Currently this comes with a filter. It's a filtered needle, correct?
Correct.
Tom? But since we are not breaking glass, we really don't need a filtered needle. So, and since the filtered needles are expensive, we're going to replace that with a non-filtered needle. So I'm going to open this. Now, one rule that I practice is anytime you've unsheathed a needle, the outer sheath or the plastic covering that it comes in, I get rid of, because we do not want people to resheath needles. So the easiest way to prevent that is to throw the plastic coverings off, which I tend to do every single time. This is the filtered needle. We're going to drop the lidocaine, and we have 30 cc of lidocaine in the vial, and we're going to drop 10 cc in both syringes. At this point, we're going to expel the air out, and we're going to attach a 25 gauge short needle to this syringe, get rid of the plastic covering so that we don't resheath it, and this goes into number 1 on the sharp tray. Because that's the first thing you're going to use. That's why it goes into number 1. So there's an order we're going to follow over here.
Now, as soon as Dr. Lampa draws up the lidocaine in the syringe, he has to label the syringe immediately.
Thanks for pointing that out, Don. So if an MD is not doing the draw and a technologist is doing the draw, very correctly pointed out that the syringe must be labeled. And that is the only way to ensure for the MD that the technologist has indeed drawn the correct drug and given it to the radiologist. In this case, the syringe has the markings on this side, so you don't want to label over the markings, so you want to be able to see the markings. So you're going to place this labeling sticker right over here, and you could write, if you wanted, over here the percentage of lidocaine, 1, there's a Sharpie in the tray, and the amount that was drawn, 10, and that's all. And that gets this part of the lidocaine ready, and this is generally for the skin numbing. Now I'm going to draw this lidocaine into the second syringe. Again, we're going to draw 10 cc. We will have 10 additional cc left in the vial should we need more. Expel the air. And now we're going to use is that a 21 gauge needle, Don, or a 22 gauge needle?
It looks like a 21.
We're going to get a 21 gauge needle,
About 4
typically about 3.5 centimeters in length. Thank you, Raj. Typically about 3.5 centimeters in length, and we use this for deeper numbing. So this will be the second thing that you will use. We do need to label it. Now currently there are some additional labels available. We are going to have a label that says lidocaine in the future, so you don't have to write it in. But right now, for the purposes of where the tray is right now, I do need to create an additional label, and I do need to write down lidocaine 1%, 10 ml. And we're going to label the second syringe just like we did the first one. We're going to put it into the number 2 position. Now the reason we're putting it numerically over there is that sometimes in the heat of battle, if you're asking your team to give you the lidocaine and you want to sort of not say out the whole sentence, you can just ask for number 1 or number 2, and number 1 will be the shorter needle for the dermal numbing, and number 2 will be the longer needle. At this point, we're also going to get our scalpel. Again, I'll unsheath it, throw away the covering, and put it at number 3, because that's the third thing we're going to need, is we're going to make a skin neck. Now, something about the skin neck I'm going to say over here, and this is mostly for the residents and maybe for the other radiologists. I'm a big believer that you should make a skin neck for most procedures, especially if you're doing a drain. It is a must. And for most core biopsies, it is a must. And the only, even for a thoracentesis and a paracentesis, I make a skin neck. The only time I don't make a skin neck is when doing a thyroid FNA with a 25 gauge needle, or doing an axillary or groin node with a 25 gauge needle. In those instances, I will not do a skin neck. Almost all other instances, I will make a skin neck with a scalpel blade. So that goes into number 3. This is the chloroprep with the tent, and you can either leave it right in here, or you can put it to the side over here, right next to the drape. There's some 2x2s in the tray. If you're going to do a thyroid FNA, 2x2s are enough. If you're going to do a drain, you're almost always going to need some 4x4s. Maybe we can talk about having some 4x4s in the kit instead of 2x2s. I think these are more versatile, but that's something we can discuss. And these are good, they serve as good soaking pads for soaking blood or other bodily fluids should you need to. There's a Band-Aid in the tray that can be just left over here and is generally used to cover up the incision at the end of the procedure. There is, I believe, an additional filtered needle over here that we did not use, but that seems to be redundant. There is a Sharpie for making a mark on the skin surface should you need to, also for labeling if you need to, and there's an alcohol wipe. We can leave all of this in here. We can put the stickers back in here, and at this point I think we are done with our tray prep. Is there anything else, Dom?
That's the basic tray prep.
Yeah. There's one more thing we can sometimes do. Should you do a drain, you may sometimes need sterile saline. So actually it might be a good idea at this point to empty out this slot so that we move the lidocaine over here, we move the lidocaine draw needle over here. This should be discarded, and that way this little tray over here can be used for adding sterile saline should that be needed for a procedure. Is there anything else you would like to talk about, Dan?
So this is the basic tray setup, and depending on how or which procedure you'll be doing, the physician is going to require you to have all the supplies prepared, ready on the counter before the procedure starts. So whether that's a drain, you're going to know ahead of time whether it's an 8 French drain, a 10 French drain. Have all those supplies ready, have your wires ready, your dilators if necessary. All those things will be talked about in the protocol. They'll be specific to the physician so that the technologist isn't going to have to ask every single time which supplies are going to be required. They'll know ahead of time.
Thank you, Dan.